Okay, so now we are going to have Colleen Jones-Down talk to us about the limits to push or not to push. It is still the question. And I'm just going to find my little bio here. So Colleen Jones-Down is the clinical lead physiotherapist at the Janeway Children's Health and Rehabilitation Centre in St. John's, Newfoundland. She earned her degree in physiotherapy from Dalhousie University in Halifax, Nova Scotia, Canada in 1996. She's had the privilege of providing physiotherapy services in the field of Haemophilia Care for over 20 years. She currently serves on the executive of the Canadian Physiotherapists and Haemophilia Care Group and had contributed to publications from the Canadian Haemophilia Society. She's completed training in point-of-care ultrasound in Haemophilia Care from Mohawk College in Hamilton, Ontario, and is a member of the Canadian National Interest Group for APOCUS in haemophilia. Outside of her work in haemophilia, her clinical specialty area is in pediatric orthopedic physiotherapy, and in her career, she has worked at multiple pediatric facilities across Canada and in Ireland. Her passion is providing excellent rehabilitative care to patients and educating others to do the same. Welcome, Colleen.
So first of all, I want to thank the organizing committee for inviting me to come and speak about this topic. I'd like to think it's because I'm more youthful that I got chosen to do the newer approach. Right, Sean? So as Julia said, I've been a physiotherapist for about 23 years. I started working with people with haemophilia about 23 years ago. And I have to say, I feel like now we are in very exciting times. There's been lots and lots of changes to our care, and I feel that now's the time that we can really forge ahead with confidence in terms of making some changes into our approach, the way we approach physical activity. So my title today is The Limits. Should we push or not push? And I feel that in some ways this is still a question. We know there's still lots of nervousness about pushing people to do sort of more intense physical activity. But we're going to talk about personalized decision-making about physical activities for people with haemophilia. And I was going to say I have 8 minutes, so I'm very glad that I'm from Newfoundland, so that my speed-speaking capabilities come in handy sometimes for this stuff. So these are my disclosures. Just going to blow past those. I don't have any conflicts at the moment. So we're going to run through quickly the history of physical activity, recommendations for people with haemophilia. We're going to talk about the advances in haemophilia care, which we've heard all about this morning. We're going to look at the benefits, which Nishan already discussed, so we'll go through that fairly quickly. And we're going to look at current recommendations on physical activity in haemophilia care from other resources, and just review an approach to decision-making in physical activity in people with haemophilia. So where were we? So let's think pre-1970s. Really, it was a no-go. You really shouldn't, people with haemophilia, especially moderate and severe haemophilia, really should not be participating in any physical activities. And they were really discouraged to not do so. I'm sure some still did, but really it was discouraged. And moving forward, with the onset of prophylaxis, there was a little more sort of, maybe we could allow them to do a little bit, but still, and I apologize for my picture of the child in bubble wrap, but I've heard this so many times in my practices, I just wish I had some bubble wrap, and lots of it. So there is still quite a protective approach. If we move forward to about 10 years ago, we kind of moved away from like sort of a no physical activity approach, and really looked at more at the activity side of things in terms of our recommendations. So there was a red light, green light, yellow light approach, and many of you in this crowd have seen some of the brochures that listed many activities, and if they were a red light activity, a green light activity, or a yellow light activity. But remembering that this approach really didn't consider the person with haemophilia. It really just looked at the activity and the potential risks in the activities. So if we move forward to where we are now, and of course this morning we really heard a really nice review of where we are in haemophilia care, and there have been many advances made since the old days when we just said no to physical activity. So we heard about the medical advances in our first session from the speakers in our first session, of course, prophylaxis prophylaxis itself and the advances in prophylaxis itself. The pharmacokinetics, Dr. Iorio reviewed all this for us this morning. There have been huge advances in our knowledge of hemophilia care, and there have been many, many articles published in physical activity, but other areas of hemophilia care. And we have wonderful venues such as the MSK conferences and WFH conferences where people can get together and share all this information. And of course, with CBDR now, who knows what the future holds in terms of our capability for research in this area. And I apologize for the last one. I should include MyWAPS as well. But of course, technology advances. We've heard Paul all day talking about what his levels are. And the reason he can do that is because he has this technology right in front of him where he can actually know what his factor levels, or what his factor levels are at the moment. So I had the great privilege this year of attending the MSK conference, and during that conference there was a fantastic panel of people with hemophilia, and this was a quote that really struck a chord with me from that particular conference, and as a physiotherapist it really spoke to me. So this guy, his name was Andrew Savalgi, I don't know if I'm pronouncing that properly, but he was a young man from Australia who was a personal trainer, and he is a hemophilia advocate. And he says, our beliefs and thoughts around physical activity and hemophilia have not yet caught up to our advances in the care of the disease. And I thought that was a really profound statement to make. So just very quickly, what do we know right now about physical activity? Of course, the Canadian Society for Exercise Physiology has numerous resources with recommendations for physical activity, and I just highlighted the 18 to 64-year-old one, which includes, which states that adults between the ages of 18 and 64 should have up to 150 minutes of moderate to vigorous exercise per week. And of course, for children, that is 60 minutes per day. And of course, there's a lot of research around the benefits of those recommendations. I also pulled up the current WFH guidelines on physical activity, and I'm not going to read through these, but essentially they are encouraging physical activity. The benefits of physical activity were already reviewed by Nishan, but I'm just going to, you can read all those benefits, which we all know. But I will say this morning when, I think her name was Leanne, the mom, got up and spoke about her little boy, my floodgates opened when she was talking about how this little boy could now play at recess time. He wasn't in a wheelchair, he wasn't by himself. So that alone, to me, is the highlight of the benefits of physical activity. So what are the risks? Of course, we all know the risk is joint and muscle bleeding, pain, prolonged immobility, loss of daily function, long-term damage to joints. These are all things that are still in our mind. But of course, the other thing is the head trauma and other potential bleeding that can happen with more vigorous exercise. I'm going to go through this really quickly because I don't have a lot of time left. So these are just a snippet of some of the research that has been done in physical activity with people in hemophilia. If anybody wants to have a look at these resources, I can give them to you, but I'm not going to go through them right now. So really what we're tasked with now is looking at the risk to benefit ratio, and that's really what it comes down to. And I feel like as a team, and that includes the patient, of course, is that this is really what we're doing, is we really need to be looking at the risk to benefit ratio, and is it worthwhile? So right now, the Canadian Haemophilia Society has this wonderful resource, and it really is a workbook that was put together by CHS with the help of the Canadian Physiotherapists in Haemophilia Care around, and it's designed, to assist critical thinking in physical activity decision-making. And the goal is to help match personal physical activity goals and condition to suitable physical activities. And it's really getting away from the safe versus not safe, or yes versus no approach. The booklet reviews helps the reader to review their self, the activity, the potential risk, and then of course to make a plan. So to assess yourself, of course, I think one of the most important things, I'm not going to go through all these, but one of the most important things in this list is individual interest, because of course I can't tell someone what they should be doing. You should be swimming, because everybody is different in terms of their interest and what feeds their soul. So that is one of the most important things. And of course, looking at your function, your physical function. Assessing the activity, it helps look at the activity and the potential risk with the activity. And once an activity is chosen, it helps to work through the risks of the activity and how to look at injury prevention and how to manage injuries if they actually occur. And of course, how to make a plan, and when making a contract can be helpful. So making an exit plan. If you do decide to participate in a more perhaps risky activity, then what is the exit strategy? When is it that you're going to kind of pull out and say, no, this is probably not a good idea for me? So I'm going to answer this real quick. So to push or not to push, I feel at we're at a stage in care of hemophilia where I think we can push certainly a little bit more, but I think we have to do so with intelligence. I feel physical activity is critical to physical and mental health and quality of life. Participation in physical activity looks different for everyone. It's important to have a personalized approach. No is no good anymore. I feel like if there is a will, we really should explore a way. And we need to encourage critical thinking in decision-making and what we consider intelligent participation.